Okay, this is testimony at Smith County Commissioners Court about the cure for COVID virus, the hydroxychloroquine, and Robin Armstrong, who saved like 80 patients and staff at a Texas City nursing home. Robin's a past vice chairman of the Republican Party of Texas, and he's the only male representative to the Washington, D.C. Republican Party convention.
Yes, Mr. Brewer, this is Thomas Wilson with Smith County Commissioners Court. You are on the line with the commissioners. I would remind you that you have 3 minutes to speak, and the rules of decorum continue to apply. You may begin now.
Okay. Good morning. Thank you, Judge and Commissioners. I want to thank you for last week and the presentation by Professor Grashel was one of the best that I've ever heard on the constitutionality of what's going on right now. Also, I had not intended to speak today until I opened up the Tyler paper. And before I get into the details and the numbers on what's being reported just wildly inappropriately, I'd like to preface that I have worked with some of the top scientists on Earth, from the father of global warming to the matriarch of climate change, and along with Carl Sagan's boss at Cornell University. There are more scientists that have referenced my work in atmospheric chemistry than anybody I know in Smith County. And the results of my work resulted in enhanced pollution controls on everybody's vehicle that drove into work today. Now, my question is, are we being consumed by our ignorance? Just looking at the front page of the Tyler paper, how can 70% of Texans behind bars had the virus, while only 155 out of 200,000 residents, that's 0.08%, have it. It's just, we are just being inundated with misinformation. Now, the other thing is how can we ignore that we have a cure? There's been insurmountable anecdotal evidence that the hydroxychloroquine is the cure. I've been on C-SPAN twice over 5 weeks ago talking about the cure, and they just poo-pooed it and moved on to some reference to a vaccine, which is only going to feed these major drug corporations. Okay, but the most recent thing happened from Dr. Robin Armstrong, who was a past vice chair of the Republican Party of Texas. He has a nursing home down around the Houston area, and they had 80 residents and staff that had visible symptoms of the COVID virus. He treated them with hydroxychloroquine, and 79 of the 80 revived. So I can't understand why you guys are having a closed courtroom when we have a cure for this hoax of a virus that is being hidden out of the media and all of the malignant TV that we have, and not allowing us to come in there. I tried to speak at City Council last week with a more prepared talk, and was not allowed to, even though it was the first thing on the agenda page. Due to the hazard of the pandemic, that they had to have a closed meeting. So we have a cure. There's no reason to continue this hoax anymore. And I still want to know, as Tom Grashel stipulated, how can he unconstitutionally, arbitrarily, and capriciously punish healthy, law-abiding citizens, farmers, and churches while rewarding the large
Looks like the county recording system has failed us. So the county playback page is failing us. So now I'm going to go to Laura Igram. This is Monday, May the 4th, the day before I made my presentation to the Smith County Commissioners Court. I did not know this happened until after I made my presentation, but this is the facts about who has utilized hydroxychloroquine on 80 patients and staff at his nursing home in Texas City, Texas.
In early April, dozens of residents and staff at the resort at the Texas City nursing home tested positive for COVID-19. The senior center's medical director, Dr. Robin Armstrong, knew time was not on his side. He had to act fast. So in addition to sheltering in place, Dr. Armstrong began treating residents with hydroxychloroquine. Dr. Armstrong joins me now. Dr. Armstrong, it's great to see you tonight. Thank you for coming on. What was the outcome of treating the residents with hydroxychloroquine?
Well, what we saw was with hydroxychloroquine, azithromycin, and zinc, we saw that we had 92% of those residents who were treated with hydroxychloroquine actually get better. And that was compared with the people that we did not treat. And so it was an amazingly positive outcome. That was fantastic. We really were in a bad situation where we felt like we were going to see a lot of these patients die. We were going to felt like the mortality rate was very high. We had seen what had happened in Washington State. We saw what has happened in Louisiana, and we felt like we needed to treat these patients very quickly with something that had been proven to work. And so what we saw in the studies in China and the studies in France is that they showed that after 5 days of treatment with hydroxychloroquine, azithromycin, viral loads dropped to 0 on day 6. And so that's what we did. We treated them with five days of hydroxychloroquine, azithromycin, and zinc, and we saw very impressive results. Those patients that were treated actually have recovered well and are doing well today.
Well, Dr. Armstrong, this is what a cardiologist on CNN said last night about the impact of hydroxychloroquine use on the heart.
We have no evidence that it really makes any positive impact in a COVID-19 patient. To the contrary, we have evidence that in some circumstances it can create dangerous heart rhythm abnormalities. These anecdotes that the president keeps touting are just that, anecdotes. And the plural of anecdote is not data, it's just anecdotes. They're really meaningless.
Okay, Dr. Armstrong, Professor Rao found no cardiac toxicity that he could find in 1,000 patients. The Chinese didn't find any. Did you see any cardiac issues in your patients?
We saw absolutely no cardiac side effects. In fact, on day 3, we did EKGs on our patients and saw that the QTC interval is what they're measuring. And so you measure the QTC interval, and that if that's prolonged, then that will predispose them to having these cardiac side effects. We saw that in all 38 patients that were treated throughout the course, none of them had a prolonged QTC interval, and therefore none of them were at risk of having the cardiac side effects that was talked about. None of our patients had any side effects whatsoever, cardiac or otherwise for that matter.
So, Dr. Armstrong, what I'm hearing from treating physicians here in Washington, D.C., Northern Virginia, Maryland, they're concerned that they are no longer free to prescribe hydroxychloroquine given the FDA's warnings that are not technically prohibiting them, but the warnings are such that hospital organizations, big hospitals like Johns Hopkins, are taking it out of its standard of care protocol, which, in the words of one doctor today, I just got off the phone with him before the show, he said people are going to die because they're not going to get hydroxy. They're going to wait till they get to the hospital, then it's going to be perhaps too late.
Absolutely. And our contention the entire time was that you need to start them a little bit earlier when they start having symptoms. That's the best way to get them treated. That's the most effective way. The FDA emergency use authorization recently, what it does is it says you can't use it unless the patient's in the hospital. My contention, especially with these elderly patients, because their mortality rate is so high in the hospital that you have to use it earlier. So they're only allowing doctors to use it in situations where it's almost too late to treat them. And so I think that we have to be aggressive on the front end. And our experience and our observation was that patients did well when they were treated with mild symptoms. We prevented them from going to the hospital, and we also prevented their mortality rates from going up. And so that was significant. And we were happy with the outcome. The families were happy with the outcome. We saw no side effects. And so I think it's a positive result. And I think the FDA is not serving us well by issuing these orders and backtracking on the previous emergency use authorization, which allowed us to use the drug more freely.
I think they have to rescind that warning. I think people are not going to live because of this warning, sadly. And I know that wasn't their intention, but I think prophylactic use in this emergency pandemic situation seemed to work for you guys, and it's probably going to work in other places. It's working around the world. Dr. Armstrong, I cannot tell you how much I admire what you do on a daily basis. So many of us have parents or had parents who are in senior facilities, and the nurses and doctors, they do really hard work. And you made a courageous call, and I really, really appreciate it. Thank you for sharing your story tonight.
Thanks for having us.
So there you go. It's the drug companies, the FDA, big drugs, big government that are stifling the health of our most vulnerable and most likely enhancing the fatalities of the coronavirus.